What's happening? Who's there? Hey, three people just popped. What's going on, guys? Can you hear me okay? Check, check. Monday night, what happened? 12:30 Eastern Standard Time, and I'm just coming on. I apologize. What's up, proficient mung bean? One of my favorite, how about Sinigan and Mongol Bean? Speaking of mung bean, what's up, girl? Caretaker! What's going on? Quincy. Quincy the Goat. Welcome back. Caretaker, first time here? I know proficient mung, that's your first time. What's going on, ladies and gentlemen? Why, thank you, Caretaker. Thank you, thank you, thank you, thank you, thank you. Why does the Party of Law and Order want a convicted felon? Makes zero sense. The Party of Law and Order. What party is that? Now, you gotta take that S off of your W there. W-A-N-T. And R-E-Y-R-E-T. Snow, Christ calling you. Repent of your sins, return to Him before it's too late. Amen. Republican is the Party of Law and Order. What's the Democrat considered? This is new to me. Oh, Wilkerson, what's up, bro? Hoorah, Donna. So the Republican Party is the Party of Law and Order. Democrats are known as what? Party of Corruption and Disorder? Oh, what's up? Hi, Donna. Don't forget the thumbs up, guys. If you would, that'll help the channel reach a bigger audience. Woof! Bad doggy Maria. Caretaker, Trump's the last hope for America. I second that motion, Caretaker. So no comment, Hugh, Janice, about the Democratic Party. Everybody got the thumbs up? Got it? The like? What do we got now? We got, today is the 9th. So we got 2 more days of October and then 5 more days to November 5th. So 7 more days, guys. Don't forget to vote. Well, what's up? What's new? Need to crash for work. All right, Caretaker. Where are you? On the East Coast, or are you in the USA? And are you a caretaker in the out there in the medical field in Colorado? Hoorah. Joe. What's up, Joe? Joseph. Well, thanks everybody for popping in so quick. That was pretty cool. A lot of new first time names I'm seeing here. Appreciate it. You still there, caretaker? I was just wondering by your name if you're in the caretaker business. Oh, gaming tag, Call of Duty. Oh, okay. Very good. Awesome. Hey, appreciate it, caretaker. Have a good sleep. Going to be a regular here on my channel or on Call of Duty? Gromir Mustaka. Joe Rogan. What's new, bro? Wolf, are you still there? Bad Doggy Maria. And Donna Chamberlain. How are you, Donna? Bo Wilkerson. Are you there? Are you there? Hugh, where'd you go? Your P. Still trying to figure that one out.Yrepee. Quincy, are you there? Are you there? What goon cave do you hail from, traveler? The cave of South Jersey. I know the name, Quincy, the goat, but I don't recall your specifics. Where you're from, male, female, age, I forget. What goon cave do you hail from, traveler? What is it? Everything looks clear down here, Captain. No signs of life anywhere. Maganda, doing well, doing good, girl. Galing, galing. Quincy, remind me again. Your statistics. Dingus, how about you? Where are you originating from? There, Nano. Phone home. I just realized what your profile picture is. What does that say? School something. RUB. Talk to me, guys. Talk to me. What's new? give me some ideas. I'm waiting for a key word to pop a memory into my head so I can tell a cool emergency medical story. Here's just a thought. It may not be very interesting for you guys, but I can talk about it. I remember going through my paramedic field training. That's where Gene Soriano, ¿cómo? Okay, I remember you, Gene. Oh my gosh, long time, I think. Correct? Gene, that's a beautiful dress that you're wearing. That looks like a traditional Filipino outfit. It's beautiful. Mabuti po naman. Salamat. Ikaw? Yeah, I was going to tell a story about my paramedic internship when I was training out in the field. And I was with my preceptor. I was actually a third person on a paramedic truck doing my training with two paramedics, and I was the third in the back. I was a student in training, so they basically were letting me run the call, and then they would critique me and score me, and I had to get so many hours in a length of time before they could pass me. And I had an opportunity once before to do this field training, but unfortunately I struggled quite a bit and I needed to redo my internship out in the field. So this was my second time through. So to say I was stressed and nervous would be an understatement, but I was more comfortable with this paramedic team. One, because this was my second time through, and I had tried to prepare even more so this time. And number two, my preceptor was somebody that I knew very well. He happened to be my neighbor when I was growing up as a teenager in San Diego. He lived right across the street from me. My brother and I both were friends with him and his brother. And then he became a paramedic. And then when I reunited with him, this was like, 20 years later. And now he's my preceptor. He's my trainer out in the field. So that made me more comfortable. Much more relaxed than the first time. So anyhow, so I don't remember where in my training I was, but we had a call, a medical call, where I think the call came as shortness of breath, difficulty breathing, basically. And that could mean anything from a child to a 99-year-old person. And it could mean they have a cold or they are having a very acute emergency, breathing emergency. So, but the generic title for somebody having any type of breathing difficulty is difficulty breathing. So sometimes you can predict what the person is going to be, what age, because the address that they send you to may be a familiar address, such as a senior citizen complex or apartment complex. So if you know you're going to a senior citizen complex, the person is going to be elderly or 55 and older. So you understand. And if you know you're going to a residential address, then that could mean anything. It could mean a baby, or it could mean an adult. So you're always trying to take in the clues, what you hear when you first get the call, what you see, the address, and you're trying to figure out, what could this be? Who is this person? So we get there, and it was about a 30-year-old black guy, male. And when I got there, I'm trying to remember, this was many, many years ago. The guy was sitting in his, I think it was an apartment. It could have been a house. And now this is a young guy, 30 years old. And when you think of a 30-year-old person, I'm asking you guys, if you think of a 30-year-old person is having difficulty breathing, is there anything that comes to your mind for a 30-year-old person to have difficulty breathing? What comes to your brain? Anything? Like, what kind of medical problem do you think a 30-year-old would be having? The first thing I think of is like asthma. Somebody at 30 years old, very common, that age has a history of asthma, or they're sick. They're sick with the flu or a cold. But not many 30-year-old people who have a cold or a fever is going to call 911, for an emergency. Like my son right now is sick, and he's having some mild difficulty breathing because his chest is congested. He's 19. So that's not something we typically would go to the emergency room or call for an ambulance for. So again, this is like what we think about. If we know how old he is, 30 years old, we start thinking, okay, what is a 30-year-old calling 911 for shortness of breath? What could it be? You start thinking, well, asthma can get pretty bad if they don't treat it, or that's typically what happens, is they don't have the money to treat themselves, and so they let it go for a number of days to the point where now they can't handle it anymore and they call 911. Or they just don't have any insurance, and this is very common. They'll call for an ambulance because they don't have a doctor. They don't have any money for a doctor. And in the United States, if you call 911, you're going to get an ambulance at your door, and you're going to get a ride to the hospital. Yes, you're going to get a bill, but if you have no money to pay for it, it's not like the Philippines, as you know, those of you in the Philippines. If you don't have any money, you don't get any treatment, or you don't leave the hospital until you pay them. Well, in America, it's you will get treated, whether you have money or not. So, a 30-year-old sometimes who has no insurance and no medical insurance, no money, will call for an ambulance. And we call that abusing the system, but many, 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 many people do that. And they get a free ride to the emergency room, and they may get treated by me, and they'll get treated at the hospital if they need it. So this 30-year-old was just the initial look at him. His eyeballs were like this. I mean, they were popping out of his head. He was looking right at you, and you can see him. You know, he's not speaking to you. He's just looking right at you, and you can see him working. You can see his muscles in his neck. You can see his chest, you know, pulling air or trying to pull air. And typically now a person with dark skin will present pale. You know, if their skin color is normally black, it will get pale, more like a gray. My skin is normally pink, like it is now. And if I'm having an acute or serious problem breathing, the oxygen isn't getting to my bloodstream like it normally does. And so when there's oxygen getting to your bloodstream, your blood gets nice and bright and red. And that's why our face and our skin color looks pink. At least a white person, you know, it looks pink. But if you take away the oxygen, then that pink gets real pale, starts becoming more white. And that's the color of that I would look like if I was having a serious problem breathing. So anyhow, this guy looked pale, and not only pale, but his skin was sweating, literally water, just moisture all over him. And so the big picture, when you first look at him, this guy's having problems. You don't even need to take his heart rate, count how many times he's breathing. You can just look at him. And many people, most people, even you guys not in the medical field, you can typically look at somebody and say, whoa, something's wrong. You know, this is not normal. And you notice I'm speaking without any difficulty. I can begin a sentence and I can end a sentence. Well, it takes air, it takes breathing to speak. And if you're not able to breathe, you won't be able to speak very well. You might be able to say 3-4 words, and then you'll have to stop and take another breath and talk again. And then you will only get 4 words, and then you'll have to breathe again and start speaking. Well, this kid wasn't speaking at all. He was having a hard time just responding. You could tell he was in serious trouble. Although he was still sitting up and he was still awake, right? If you take away the oxygen long enough, not only will you stop speaking, but your brain will start to lose its ability to stay awake, and your consciousness will disappear. And then that gets very extreme, and that person's dying because they're not able, the oxygen is not enough to even keep them awake. And then that just makes the whole body shut down eventually, if you take away all of the oxygen. So this guy was in real bad shape, and he's young. You could tell. We found out, I forgot if we had family or friend or somebody there. And he had really no medical history like asthma. People 30 years old um, they don't typically have a medical history. Like Gene, I don't know how old you are. Ilang taon ka na? Anyways, when you're young, you typically don't have a medical history. Some people do, but older people, because they're getting older in life, they have the longer medical history. Diabetes, high blood pressure, asthma, heart disease, you name it, stomach problems, cancer, the list goes on, because that's what a body does. It gets older and it develops diseases and injuries and illnesses. So he didn't have a medical history, although we found out he was a drug user. And I forget what drug was his drug of choice, but whether it was heroin or cocaine, or I think he was an IV drug user. He was injecting, using a needle. And so it's like things start happening really quick for the paramedic. And I'm the student. And I remember, it's like, I'm in charge. I'm the one in training. Piemski. ¿Cómo está, bien? Nice to see you again and again. So anyways, as soon as you see somebody breathing, having difficulty breathing, there's like a priority. And we use this abbreviation to remember our priorities, and that's A, B, and C. A stands for airway, B stands for breathing, and C stands for circulation. That's your heartbeat, how fast or how well the heart is beating. Mabuti po naman. Salamat. Bienski. Bien. So part of his airway was open, meaning, this is the airway, your mouth and your nose. That's where we take in air. So we want to make sure that is open, and it was. Part of that airway is your lungs. So I have a stethoscope, that listening device that doctors put in their ears, and nurses and paramedics. And I want to listen to his lungs and see if that part of the airway, this is a little deeper in the body, but air enters the nose and mouth. It goes down your trachea, down the front of your throat, and then it branches off in a Y to each lung, right in your left lung. And so I want to hear that. Is it clear and open? So I can listen to that. And as soon as I started listening to his lungs, it was like he was breathing through water. When you take a straw and you put it in a glass of water and you blow, bubbles, right, go through the water. Well, if you take air and you breathe it into your lungs, and your lungs are full of water, what am I going to hear with my stethoscope? I'm going to hear gurgle, 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 bubble, 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 right? Well, that's exactly what it sounds like. It sounds like air bubbling through fluid. So what in the world is water or fluid doing in his lungs at 30 years old? Why would his lungs be filling up with fluid? And so these are the things we listen and we think. And Meanwhile, you have decisions to make real quick. And so that's I just remember this call where a 30-year-old black kid was in acute respiratory distress. And by the time I finished listening to his lungs, and now we're doing things like starting an IV into a vein somewhere. We're trying to find a vein anywhere we can. Why is that important? Because that's the route of administering drugs that we can help him with. And so in order to administer a drug, you need to access somebody's circulatory system. That's their vein or their vessels. So that's why we start IVs, so we can administer fluid and medications. So we get that established. And then it's just a matter of a sequence of drugs that we can give him to help move the fluid out of his lungs and back into the bloodstream where it belongs. Blood and fluid, or I should say, blood is made up of fluid. So we want the fluid to go back into the bloodstream, not into the lungs. The lungs are made up of like a bunch of microscopic grapes. It's like a bundle of grapes. They're called alveoli. And those grapes should be filled with air, not fluid. The fluid is in the bloodstream, around those grapes, or inside the lining of those grapes. They're called alveoli. But inside that grape should be air. And in his case, it was full of fluid. So you can imagine trying to breathe. It's like breathing underwater. You can't. It doesn't work. So fill up all your grapes in your lungs with fluid. What does your breathing look like? You're just struggling. You're pulling on water, and it doesn't work. And then your color of your skin starts to change to gray or white. And then if you take away the oxygen out of the blood cell long enough, blood starts to get dark and blue. And then it eventually becomes like purplish. And that's what your skin starts to look like. You start looking not only gray, but you start looking blue. Your lips turn blue first. The tips of your ears, the tip of your nose, even your eyes, the capillaries, around the pink of your eyes, even your fingertips, because that's the furthest away from your heart. Everything furthest away from your heart starts to turn color the quickest. So that's what he was starting to look like. And we were able to get drugs on board. I'm not going to go into the different types of drugs that we give, but the whole idea is to get the water to move out of the lung back into the bloodstream. And if he's breathing, if he's having that much difficulty breathing on his own, we can try to help him. We can either put a tube into his trachea. He won't be awake if I'm going to do that to him, because he's going to fight me if I try to put a tube down his mouth into his trachea, into his air tube. If I tried to do that to you, BN or Gene or anybody, you would probably punch me in the face, or you would push me away, because I'm trying to put a tube into your breathing apparatus. And that doesn't, a conscious person isn't going to let you do that. So another way we can help you is by putting a mask over your face, which is difficult too. If somebody's truly struggling to breathe just in the open air, Can you imagine having a mask put over your face? You're going to probably push that away also, because you're fighting already. And now you're going to cover my face while but I'm really trying to push air and help you. And I have that, you've seen it probably in movies. It's a big kind of oval bellow bag that they squeeze, and it helps squeeze air into that mask and over your face, into your nose and into your mouth. So anyhow, we were able to actually help him like tremendously by the time we got to the hospital. Now that's just temporary. He was, let me tell more of the story. When we were in his house, I was saying by the time I listened to his lungs and we got the IV established in his arm, he was starting to pink foam, blood tinged like sputum, spit, but almost like foam was starting to come out of his mouth and out of his nose. That fluid that I told you about inside his lungs starts to get that pinky color, because even some blood cells will start to move across those grapes into the inside of them. And now you've got kind of a blood pink tinged foam, air-filled water starting to come out of his mouth. And he was bringing that up, and it wasn't coming from his stomach. This was coming from his air tubes from inside, moving now to the outside. And that was pretty impressive to see somebody. I think that was the first time I've seen that. You don't see that from a 30-year-old man or woman. But we found out later that more than likely his drug abuse, his IV drug abuse, was causing his heart to fail. It was probably getting inflamed, like inflammatory, like you've heard the word inflammation, turning red or swelling up. Well, his heart was starting to do that. It's called pericarditis, an inflammation of the lining of his heart. And that just causes like a snowball effect on his heart. And when your heart starts to fail to pump like it should, that whole effect starts to spread throughout the circulation system. And then that circulation system eventually, as I told you, surrounds your lungs. And so now instead of the fluid moving in the direction it's supposed to be going, it starts to move in the other direction and starts to fill up the open spaces in your body. It's pretty wild when you see it and learn about it, what is normal, and then what happens when the body starts to fail. Certain organs like your lungs start to fail, your heart starts to fail, your kidneys start to fail, all of your body functions start to stop working. The body just starts to respond in these really bizarre ways. And this is one of those instances where his heart was failing at 30 years old because of chronic abuse, drug abuse. And so now we've got what we call a heart failure patient. You see heart failure in elderly people because I told you before, they get old and their heart gets old. And then those disease processes start to, happen to older people. but not to 30-year-old people. But this was a cool, unfortunate for him, but for a student, a paramedic student at the time, I was like, wow. And then afterwards, we talked about it, my preceptor and his partner and myself. We all critiqued the call. And even my preceptor was saying, that was a pretty cool call. It's like, whoa. You don't see that very often. So that was a memorable call, and I did well. So I scored points on that call, and I did do well through my internship, that my second time through, and I eventually passed. It took me, I think I worked with them for about 2 months, I think a little bit over 2 months. And I had to get so many hours. I had to spend so many hours with him and get so many calls. So, yeah, I eventually passed, and I got my license as a paramedic in 1993. And then I worked for about 15 years after that, till 2008. And that was my last year working in the medical field as a paramedic. So good stuff, good memories. And I've said before, unfortunately, my good memories are on behalf of somebody else that is sick or injured. But that's the medical field. Somebody has to be sick or injured in order for me to be busy. And yeah, I had a blast. It was a Mr. Toad's Wild Ride. That's a good way of describing my career in pre-hospital emergency medicine. Pretty cool stuff. Everything from delivering babies to shedding tears watching a 85-year-old man lose his wife after 56 years of being married. And yeah, that was crazy. I've told that story before. I should tell that story and do a video about that call. That was I have a hard time telling it many times. Right now, when I think about it, I don't have any emotions. But when I tell the call and I progress through the call and I relive those moments, yeah, it's very common that I end up having a hard time talking about what I saw, and what I experienced. It was crazy. So anybody still there? Biensky, are you still there? Sorry, I'm ripping my sock. I had something stuck on my sock, and I just ripped a hole in my sock. Very good, Gary. Oh, well. Knock it off, Gary. Oh my gulai. Yep, I got a hole in my sock now. So, Biensky, are you there? Hello, hello. Gene Soriano. It's like I was saying earlier, it's like I recognize Gene, but I'm probably wrong. Almost like the name goes way back years ago, but probably not. Girl in the mirror, what are you doing? Are you getting ready for live stream yet, or too early? It's or are you taking a siesta? 1:15 hapon in Rizal, Philippines. Luzon, Philippines. Oh, I fixed my trailer. I don't need to. I'm going to cancel my appointment tomorrow. I was going to have them um, install a modification to so that I could have lights on my trailer, and I figured out the problem today. And then I was out at when I was supposed to start my live stream. I forgot it was Monday. I was out in the driveway in the dark, in the cold, um, doing some wiring, electronic work on my trailer, and I finished it. And I have lights. All my lights are working. My trailer wiring, good to go. And I don't have to spend any money. So that's good. Hello, hello. Are you the only one there, girl? Hola? Give me one moment. I'm going to, let's see here. I'm going to go get something at lunch. Wait. Pardon. Excuse me. I'm going to get, what am I going to get here? Celery? Something for lunch. Snack is a stalk of celery or two. And that sounds delicious. Sarap. Manami. Nami. In Bisaya, what is it again? Ayo, girl, kaayo, right? Isn't it? Is that what, girl? Uh, delicious. Is that kaayo in Bisaya? Oh yeah, I remember now. Lamet kaayo, right? Isn't that correct? Girl, delicious. Girl in the mirror, are you there? Anybody? Come back, come back. Where'd you guys go? Right? Delicious in this Bisaya is lamit kaayo. Come in, come in. Don't skip. Come in. Excuse me, I'm feeding my face. What's up, guys? Oh, there were 3 people watching. Now there's 1. Anybody else? Wait a minute. What happened? Oh, there it is. No response? To whom, Jan? John? John? Did you say something? I'm scrolling back. I'm here. I was just muted because I'm feeding my face. Sorry, I'm crunching away here. Where are you, John? John J? JJ? Sorry if that's really loud. Oh, JJ, are you there? Are you there? What's up, bro? I'm gonna guess. John, are you there? Are you there? Who else is here? Oh, now it looks like there's 0 people here. All right. Well, that was fantastic. Anybody else out there? Ah, it's the bass. This guy almost put his head through. Boom. OMG. You see that piece of debris strike the building right behind that guy's helmet? He almost moved his head right in the line. Boom. That's called danger close. Boom. Crazy. Not a good place to be, that's for sure. John, where'd you go, bro? John J. Come back, JJ. Hello, hello. Anybody there? Come on in. Join me. Don't swipe, guys. Stay here. Just stay here. Guys, let me see if I can pull up a video for you. Talking about another emergency medical call. See if I can make this work here. Without being on a laptop. All right, let's see if we can do this. Try again.
I was up in Oregon, Washington County, Oregon area, working as a paramedic in 1996 to 98. And I lived across the street from a guy that was, I believe he was a X-ray tech. And he was working the night shift as well. And he'd get off at 7 a.m. in the morning, as did I. So as I was coming home, it was very common for him to be driving his SUV into the driveway across the street, and he'd get out in his scrubs, and here I was in my paramedic uniform. And I'd greet him and say hello, and sometimes he would greet me with, "So what's new in the annals of human stupidity?" So we had exchanged war stories, and one of the stories he told me about was he had a guy come into the emergency room complaining of abdominal pain. The nurse usually comes in and asks, "So what's going on?" She writes it down and transfers that over to the doc, and then the doc eventually comes in and sees you. Well, apparently he didn't want to share any more details than necessary, that he wanted to speak to the doctor, to the male doc. The x-ray got notified to come in and get an x-ray for this guy, and this neighbor of mine was the tech, so he brought him back. But when he did the x-ray and got the initial x-rays up on the screen, he realized what he was dealing with, and he told me this guy had a psychiatric background, was successful at putting an electrical cord. Let's see if I got one. He took an electrical cord, prong end first, and inserted this thing into his penis.
Are you allowed to say that during live stream?
Am I allowed to say that? Why? It's a word. It's a medical terminology. In his urethra? What in the world? How in the world would I even, how would you do that? Start off with one prong first? What'd he do? Even if he pinched them together and made it narrow, how'd he get this section in? He had an electrical cord. The ER without a green 6-foot cord and dangling between his legs. Inside of his
Okay. If anybody's still out there, let me try that again. If I'm not mistaken, the video was kind of getting good there for a second before I lost it. So let me try again. Let's see. If it doesn't work, then I'll just give up and we'll go from there. But let's see if we can get this video to play.
I was up in Oregon, Washington County, Oregon area, working as a paramedic in 1996 to 98. And I lived across the street from a guy that was, I believe he was a x-ray tech. And he was working the night shift as well. And he'd get off at 7 a.m. in the morning, as did I. So as I was coming home, it was very common for him to be driving his SUV into the into the driveway across the street, and he'd get out in his scrubs, and here I was in my paramedic uniform. I'd greet him and say hello, and sometimes he would greet me with, "So what's new in the annals of human stupidity?" So we had exchanged war stories, and one of the stories he told me about was he had a guy come into the emergency room complaining of abdominal pain. The nurse usually comes in and asks, "So what's going on?" She writes it down and transfers that over to the doc, and then the doc eventually comes in and sees you. Well, apparently he didn't want to share any more details than necessary, that he wanted to speak to the doctor, to the male doc. The x-ray got notified to come in and get an x-ray for this guy, and this neighbor of mine was the tech, so he brought him back. But when he did the x-ray and got the initial x-rays up on the screen, he realized what he was dealing with, and he told me this guy had a psychiatric background, was successful at putting an electrical cord. Let's see if I got one. He took an electrical cord, prong end first, and inserted this thing into his penis.
Are you allowed to say that during live stream?
Am I allowed to say that? Why? It's a word. It's a medical terminology. In his urethra? What in the world? How in the world would I even, how would you do that? Start off with one prong first? What'd he do? Even if he pinched them together and made it narrow, how'd he get this section in? He had an electrical cord. Plug in first. I don't know if he cut it off so it was short. I would imagine he would have to in order to get into the ER without a green 6-foot cord and dangling between his legs. Inside of his urethra. What? Which leads me to the next story. I don't know what they did with him. Surgery, whatever. Let me plug this back in before I lose my battery. The next one was along those same lines of insertion. I was in EMT school in Southern California, Mesa College, San Diego. For any of you out there, San Diego natives know what I'm talking about. Right off Genesee Avenue. Correction. Okay. The class, the EMT course was given at Miramar College up in Miramar. There were also classes given at Mesa, but I stand corrected. This was at Miramar College in a bungalow where we had our anatomy physiology. And the instructor was a nurse. Let's see what subject we were studying, anatomy, I guess. And she brought in some visual aids for the class that night. It was a night class. And she had some x-rays. So we were learning about the differences between the female and male anatomies, skeletal structures, in particular the pelvis. And she would hold up an x-ray of a pelvis, and we'd try to identify, based on the knowledge we were just given, whether it was a male or female. Don't quote me on these numbers, but a female's pelvis is going to be 45 and a male's is 33, something like that. Or in other words, a male's is narrower than a woman's. And then she holds up another. Now that we got that down pretty squared away, she holds up another x-ray of this pelvis. And she says, you notice anything abnormal about this x-ray? Everyone's raising their hand or yelling out ideas, and she's like, no. It's like, what in the world? Well, I can notice something in the pelvis is kind of the shape of like it's got beveled sides to it, about like this, and it obviously looks man-made. It's got a flat bottom and then kind of an angular edges as it widens to the top, and then a top to it. And you're like, what? And it's right seated, like right at the bottom of the pelvis, that angle. Well, nobody got it, but you're probably all trying to guess what in the world. Well, it turned out to be a small sized Skippy jar.
You're not gonna be.
Skippy peanut butter jar?
Nobody, none of the trans.
I don't know. Was it glass or plastic? It doesn't matter. But it's in the pelvis. So you can read between the pelvis as far as what route of entry, the only route of entry that thing could have entered. And it was a male pelvis, by the way. Sorry. Well, apparently, as the story goes, this guy came into the emergency room. It was one of the nurse's patients when she was working in the ER. And the story was that when asked, how did it get there? He claimed he fell on it. He did what? He fell on a Skippy jar. And it inserted into his anus, rectum, hell, killed him. No. Badoom. Anyhow, yeah, he claimed he fell on it. And it just strategically went up inside of him and lodged itself up in his rectum. So there you have it. And I would imagine they had to surgically remove that one. And so you tell me, an electrical cord inside the urethra and plug in first, and a Skippy jar in the rectum. Yeah, for the lay people out there that have no idea that these types of things really do happen. And more than likely, they're happening in your neighbor's house next door. It's somebody's neighbor, right? Those people were somebody's neighbor. So anyways, yeah, the annals of human medicine, we'll say.
You need to learn how to make it, children.
We'll leave out the word stupidity.
You need to learn how to make it.
But you insert your own word. Thanks for listening, guys.
Did anybody get a chance to hear that? Oh, sorry. Mute this video. There it is. Well, I don't think I had a viewing audience. Was there anybody? Were you there? I think Girl in the Mirror is the only one that is like in the background. Was that you, girl? Hello, hello. Check, check, check. Anybody? Testing 1, 2, 3. Well, it's almost 2 in the morning. I normally live stream from 10 p.m. till 0200 or 2200 until 0200. But I got on really late, about 12. Gosh, what time was it? 12:24, something like that. And let's see, 24 minutes. Yeah. Or thereabouts, something like that. So maybe I'll just keep this short and sweet. And at least I was able to tell a few stories I can get a few shorts out of this hour and a half worth of live stream, and I'll post those later on. Hopefully, probably within a couple days, I'll have another or two short videos out there for the channel. So anybody want to join me for the last 6 minutes or so of the live stream? Who knows, maybe if the population picks up, the turnout starts to grow, I'll stay on for a little while longer. But so far it looks like I'm preaching to the choir. Now what is this? This says edit. Oh, you can change the color, I guess. Yep. Okay. Is that you, girl, in the mirror? I see one set of eyeballs. Oh, there was one set. Now there's 0. Let's see if that makes any difference. Let's see. Maybe there's one more I can squeeze in. Let's see what we can find here. Stand by here for a second. All right. Maybe one last video and then I'll call it a night. Let's see here.
Sometimes the
Where is it? Where is it? I gotta get back to the list so I can choose here. Whoa, the heck?
I was up in Oregon, Washington County, Oregon area, working as a
See if I can get this format back.
Back out on the water. Let's tell another emergency medicine story. So this was a medical shortness of breath at a residential location. We get there and we find this lady laying down on her back. She looks cyanotic. She's purple around the eyes, the nose, the face, the earlobes, etc. Her skin is cool and diaphoretic, meaning it's profusely sweating. Firefighters already have her on a non-rebreather. That's a oxygen mask at high flow, 15 liters. Somebody puts her on the monitor and somebody starts to look for IV access. We got somebody helping her to sit up, propping her up on pillows the best we can to at least get her in a semi-sitting position. I listen to her lung sounds and she's barely moving any air. She looks obviously hypoxic or without oxygen. In other words, this lady is in a bad way. And well, first of all, when I sat her up, I vividly remember her reaching out to me and holding on to my wrist and digging her fingernails into my skin. And the pain got my attention, and I looked up at her, and her eyeballs were popping out of her head, and she said 2 words, "Help me, help me." And that's what we call speaking in 2-word sentences. That was about all she could manage with the amount of air that she was drawing in. We get a firefighter behind her, trying to help her, assist her breathing, what we call positive pressure, to try to open up her alveoli, or the grapes that the lung tissue consists of on a much more microscopic scale. So what is happening is there goes a fish. He just took off with my, oh, look at that. That was cool. That's par for these bodies of water. So we're attempting positive pressure, trying to get that fluid back across the alveoli and open up her lungs so she can breathe a little bit better. difficult to manage, but we're trying to do that. Firefighters are helping me out. We get an IV established, thank God. We get vital signs. We take her blood pressure. She's got an adequate blood pressure. I believe it's hypertensive, which is a good thing because that way I can give her medications that will dilate her blood vessels, drop her blood pressure, as well as decrease the workload on the heart so it's not pushing fluid into her lungs. Yeah, we want air in her lungs, not fluid. We give nitroglycerin under her tongue and a 1/2 inch or 1 inch nitroglycerin paste. It's literally paste that comes out of like a toothpaste tube. And you put it on a piece of paper and then you adhere the piece of paper, or you stick the paste onto her chest or onto her back. And then we give her Lasix. That's a diuretic, and that helps diurese her. All this medication, again, is to decrease the workload on the heart, and then the diuretic is to get the fluid moving in the right direction instead of into her lungs. So anyways, she did not initially respond in the house, so we got her loaded up. We got her into the back of the ambulance. We got her en route, made the phone call to the hospital, let them know we're coming, what our ETA was, and we continued treatment. She did get better. She actually was awake and able to speak. Her color comes back, her skin dries up. Pretty amazing what this actually simple treatment can do for a person who is literally dying from their heart becoming so ineffective that fluid starts to move in the wrong direction and starts to fill up the lungs. And then it's like being underwater. You're literally drowning on your own fluid. That is a typical CHF, or congestive heart failure, call. As the one Navy SEAL YouTube channel, I forget his name, 7 something, says, enough said. As you were, guys.
All right. Oh, we got a comment. And sorry about that, guys. I was, no, I think you were watching videos of me. I hope, Mr. Ottenreich, something like that. How are you, Kurt? Actually, I'm ending my live stream. Yeah, I came on late and decided to squeeze in an hour and a half, hour and 45 minutes, or hour and 40 minutes worth. And that's about it. Give you an opportunity to listen to some of my past pre-hospital emergency medicine calls from 1989 to 2008. Hey, Kurt, if you haven't already, click that thumbs up icon. Help me get this channel out in front of a few more people. And yeah, if you want, subscribe. I'll be here Monday, Wednesday, Friday, 2200 till 0200, normally, when I'm prompt and on time. So thanks again there, Mr. CA. Appreciate it. Thank you, brother. Take care. As you were, people. Always. See ya.